So what I thought would be really interesting to talk about first is really sort of the history of global health and how global health has traditionally sort of operated. And as you know, many of our audience members might know that global health has traditionally been quite developed country-led, even where the models of what a good and healthy health system is really founded on Western notions. And it has been largely driven by technology and science. And you know, there's a reason for that. You know, there was a lot of really important work that was done. Examples include, you know, the development of drugs for HIV/AIDS, really important work in vaccines for diseases in measles, polio, DTP. And then, you know, even if you look at malaria, all the sort of innovations there regarding bed nets and other technologies to prevent the control and control the spread of malaria. But this has been shifting now in terms of the types of focus and models that are being used in global health. And so what we're really seeing is an evolution from more what we call supply side innovations, where we're thinking more about the availability and access to really important health technologies and products, to thinking about the demand side, the side where how do we sort of increase adoption? How do we think about the needs of the people who will be using these health technologies, health products, and really coming to the health system? And so no longer is a concept of like build it and they will come, right? We're beginning to now understand that there's a huge importance on thinking through the cultural and societal fabric of the lives of the people that we intend to serve. Looking at people in a really holistic sense and trying to understand their individual needs, because not all new mothers are the same, for example. And so really understanding those nuances is kind of where we are now. So this is just sort of one way to think about how global health has evolved. You know, Tracy, I know you and I have been chatting about, you know, the history of global health. I wonder if you could just kind of share your thoughts on how it's evolving.
Sure. I mean, I think, Neeti, that you covered it really well. I mean, when you think back to the early 1900s, the advent of global health came through infectious disease, as you noted. It also came through sort of more of a military focus on health, and that sense of sort of a broad view of what a health system needs to provide was not the focus. And you know, you see WHO middle of the 1900s coming into being, but really sort of perhaps unintentionally, you know, solidifying that sense of silos that you mentioned. So malaria, TB, you know, ultimately HIV, and there wasn't a sense of sort of how do we work across those silos. And it's more in the early aughts that you start to see the idea that we actually need to be thinking about how do we engage communities, how do we understand that social context more. That starts to come into play. And so you see efforts like Design for Social Impact, Design for Good, a number of conferences around the world start to crop up there. And design slowly starts to come in is that as one of the ways that we can really elevate user voice, that we can think about that, you know, what it takes to really invest in a deep understanding of context, what it looks like to iterate with users, but you know, and a lot culminates in the SDGs, the Social Development Goals. You know, there's 17 goals that are, as you noted, sort of looking at life a bit more holistically. But it has, I would say that global health has struggled with the ability to really spend time in that upstream systems, social context space. And so the prevalence has been to think about interventions on the downstream side, you know, how to approach individual behavior change, how to think about how individuals seek and receive and adapt and maintain care and treatment. I will say, you know, we've mentioned the pandemic already once. I do believe that the pandemic is sort of laying bare that how we've been doing it so far needs to shift a bit. And I think that design, or I hope or I hope more people see that I believe it's uniquely positioned to really step into this space where we're seeing very clearly that we need to think about social problems through the lens of human behavior, and be willing to sort of get into that complexity, that way of thinking about systems that Jumana, you know, so much of her work focuses on. That there's a really there's a in the midst of this turbulence and chaos and pain, there's an opportunity to sort of rethink how it is that we're doing global health, and to take that more systemic and sort of socially contextual view to how we change these really sort of intractable, or address these very intractable challenges.
Right. Thank you so much for that, Tracy. You know, what I really picked up on is sort of the idea about, you know, global health historically being so siloed. And Jumana, I know that, you know, the World Bank thinks about a lot of these challenges in a pretty holistic sense. Is there anything that you would like to add?
No, well, yes, just to say that, Tracy, a lot of this resonates with me, and we've had a conversation about this before where, you know, it's looking beyond the individual to the communities and to the ecosystem in which problems reside. And I feel like a lot of the work that the bank is also doing around human capital, the bank and the global things that are happening around human capital, is really looking at drivers is really looking at health and education and social protection as drivers of well-being and productivity, not as hopefully outcomes of productivity over time.
Right.
And I think that those are frameworks and kind of you know, positive things to really help embed this more systematically and more at scale. I will just say, I mean, I also think that, you know, human-centered design, or design in the Western sense, in health, has come, you know, just in the way that you've described, Tracy. But I would also say that, you know, we human beings know and have been telling us what they want throughout. So to me, like, design is a way, as you rightly point out, to really bring those voices to the fore and really use them as core and central to designing sustainable, equitable health. And I think, as you said, there is no other time than now. I mean, COVID-19 is such an opportunity, and it's an opportunity I don't think we can waste.
Yeah.
These are all really great points. Maybe we could transition to, you know, the work that both of you are leading today. And, you know, starting with you, Jumana, you know, you talked about the importance of bringing the voices to the fore. Can you explain some of the maybe tools or sort of the programs that you're leading so that you can truly keep those, gather those perspectives and keep them top of mind?
Sure, and I'm gonna, sorry, I'm a bit ill today, so I'll be taking sips of water throughout. I apologize. So just to say, I think human-centered design, as Tracy has mentioned, it's not new. I do think that it needs to be amplified, and I think it needs to be brought more systematically into organizations and places where there is power to actually shift how we do things, right? And so one of the things, and of course at the bank, one of the things that is true is that, you know, there's a lot of programs that have embedded HCD within the bank. What we have done over the past year, and what I'm really excited about, as I'd mentioned, you know, I kind of stumbled onto human-centered design several years back, and we kind of formed these communities of like-minded people in the bank, informal, that were doing things throughout the bank. But the opportunity that we got this past year is really to think about how we can systematically bring it into our health programming. And that's really exciting. And actually, we partnered with Artefact to really design a set of tools and methodologies that really were adapted to the bank operational context. And this was a several month endeavor, lots of iterations. I was humbled many times, I would say. And I think the idea is, and really the hope, I mean, we're just starting to roll it out in the coming months, is to lower the barrier of entry to really taking HCD on. So I think most of the people that are on this call, there's a certain mindset that you have, right? Like you're asking the right questions, you're trying to probe. And I think most people that I work with in the bank and other organizations that are working in the global health space are committed, wanting programs to work, wanting programs to be sustainable and have a high impact. But learning a whole set of like, this is now HCD and you need to bring this in the context of this urgency that we're constantly working in is difficult. So we really looked at the bank's operational cycle and defined different moments that mattered where HCD would make a really big impact. And, so during the design phase, during, certain parts of the operational cycle. And the idea is that really what we did was we helped design the tools and methodologies with the support and leadership of Artefact, but then really had not just that, but different intensities of how these tools could come in. So whether it be through workshops, intentional questioning, and the idea and hope is that this will be taken on by our task teams and our clients, our country governments, as they design and implement programming. We're just starting to implement, but I'll really, keep everybody updated as we move forward.
Yeah, that's super exciting. I'm so glad you brought up the work that we did together, Jumana. But yeah, absolutely. I think one of the things that we see is we sort of help organizations on their journey to be to sort of learn and adopt the best practices regarding design is that it has to be quite tailored to that organization's context. And each organization faces different resistance points in terms of what it takes to be able to adopt design as a mindset and a practice. And sometimes it has to do with making the business case, and that's not clear, and people really want to understand that from that perspective. Others are willing to accept, that it has value, but they just have difficulty dedicating the time and resources when they're sort of flying fast forward, and we're asking them to slow down a bit. That can also be a very difficult moment for programs and for organizations. Tracy, could you comment on your experience of really being a pioneer trying to help not only the foundation but your grantees as well try to adopt these practices? What are some of the things that you've faced, and where have you seen successes?
Yeah, no, thanks for that. Echoing a bit of what Jumana was saying, I think part of the challenge is understanding that design is not one thing. It's a mindset, as we've talked about here. It's a process, so it's a way of approaching work. It's allowing room for that iteration and so on. And then it's a set of skills. And one thing I've always reflected on, it was an amusing time. I've been at the foundation almost 7 years, and I'd probably been there about 1.5 years. And I introduced a colleague to an interaction designer. And this colleague said, wait, there are different kinds of design? And I remember sort of trying to realizing, wow, I have to really start back at the fact that designers are like doctors. They're all trained in certain things, how do you visualize things, complex problem solving, but then they also all bring different skill sets. And so one of the things that I've tried to do with tools, because, Jumana, I'm sure you got this as well, there's always well, give me the tool and I can do it. But because it's not just the tool, because it's also that mindset and that process, the tool is not enough. And so I've sort of taken on this hidden curriculum in the tools that I have designed for the foundation, in that you can't do the tool without changing the mindset. Because there are lots of toolkits out there. And I've talked to people who've designed them that say, yeah, I guess in the end, you can go through the whole toolkit, but if you didn't have that mind shift change, you didn't get to a different answer. And so I've taken on sort of, how do we do that? Within the design? And that's like a really gnarly, complex problem for designers to sort of, hone in on. How do we make sure that you don't get through the toolkit without having changed that mindset? So I think that is really something to consider. I think there's also what I have found has been one of the biggest challenges is a lot of times it feels so big and it feels so insurmountable because what design asks you to do is go back and reframe the question from the person's point of view. And so how do you help people? Yes, you're going to go back and sort of reframe this problem, but it doesn't mean everything you've done along the way has to be thrown out. It just means we're going to sort of shift the focus and run everything that we're learning and thinking about and the goals that we're trying to get through that new focus. And I think when you get people there and you help them realize that it is that reshift and some doors open up to them, you can get them through that journey a little bit more easily.
Tracy, maybe you can give us a specific example. So when you're talking about the work that you did in vulnerability, what's the shift that people need to have as they sort of rethink the challenge there?
Well, I think, it's funny in some cases, some of it started or my desire to sort of dive into the aspects of social vulnerability sort of started very early on when we used a typical, method, journey mapping, with some leadership. And the focus was always on, well, we just have to get them into the facility. And so we created these journeys and we help them actually see that if we're only focused on that woman when she enters the facility, there were so many additional opportunity areas that we missed because we hadn't really reframed this from her perspective. And so it started to help people see, okay, I need to think outside of the facility into all the other ways that she gets there. It also, a simple switch was when we, in maternal and neonatal child healthcare, we talk about the delays, the 3 delays model. And that is, and so what is it? What are the 3 delays that a woman and her family goes through to get to the health center? That's always really been a stumbling block for me. Like she's not delaying care seeking, particularly for a young child. She's actually doing a lot of stuff. And there's a lot of energy being spent, and it's not a delay. And so one of the things that we've done through the pathways work is demonstrate that they're not delays, that there are these thresholds that she needs to cross. And there's a lot that she often needs to do to get over those thresholds. But even that slight switch of, it's not an individual person who's not doing something the way we want, that it's actually social structures are set up to put challenges in her way. And that shift helps us rethink about what are the actual interventions and what are the improvements we need to make to get that woman and her family the care that they need.
That's super powerful. Thank you for explaining that specific example, because I think when you think about it then on structural terms or social terms, you're able to see that it's no longer just a health issue, right? It has to do with cultural values. It has to do with maybe financial systems, everything, that you have to sort of address. And again, goes back to that point that, we need to be looking at these problems holistically. I think one of the things that when I think about the challenges of global health, even if I thought about it narrowly, it's quite overwhelming. Now that I have to think about it in this very holistic way, where do I start? What tools can I use? Jumana, do you have any comments on systems thinking and how we can sort of like wrap our head around the complexity of these problems?
Yeah, I think I love the way that you kind of framed it, Tracy, that tools and methodologies are necessary, but they're not sufficient, right? So I do think that there is a place for tools and methodologies, but if that's all that you're focusing on, then you're not going to get there. Maybe I can just talk about it a bit in the context of this Futures of Health Systems Leaders program that we're kind of putting together. And we've been working on for the past year. I'm co-leading it with my colleague, Liza, who's online, I hope. So shout out to her. But basically, when you're thinking about managing programs and leading programs or designing programs in the high degree of complexity and uncertainty that we're constantly in, we have to go beyond the technical. And to me, that's really looking at human-centered design as part of a systems thinking approach, really looking at it and we've kind of framed it in these 4 shifts across strategy, planning, design, and organization. So really thinking about foresight, really thinking about systems analysis and systems thinking, human-centered design, and anticipatory collective leadership and teams, right? And so these are the 4 areas that we're building and designing this program around, which is highly, highly experiential, and it's a multi-month program. And the idea is that as teams go through this, they have this shift in mindset and methodology. And the way that we're doing it is that the teams, the government teams, it can be for any team really, they pick the problem, the health service delivery challenge, the health priority that they're working on, and that they use that to then apply what they're learning directly to the problem that they're working on. And so they're building this muscle of the mindset shift, right? And I'll just give the example from what we're doing with human-centered design, and Nonso's online. He's really been leading. He's a designer based in Abuja, and he's really been helping us think through how this can come through in the program, really taking some of the work that we've done with Artefact and applying it to this program, and really bringing his expertise to it. But the idea is that, these are health systems leaders, and they're leadership teams that are here in managing complex programs on a daily basis. The idea is that over the course of the program for human-centered design, we're really having them go deep on the tools and methodologies. So they're doing a rapid empathy exercise. They're using a lot of the tools, and they're applying it directly as we are taking them through the different mindset shifts, on iteration, on not knowing everything up front, on really asking the right questions and defining the problem. And really the hope is, okay, maybe some of them will change their jobs and become a designer, which would be amazing. But the hope is that once you go deep and you really get into a perspective like that, you can't unsee it, right? No matter where you go. Like once you're in it, right? And so that's the hope with really coupling the mindset with the tools and methodologies. I'll stop there. Thanks.
Yeah, that's super powerful. I love the program, and I really wish you the best with that. And I think the fact that you're sort of tackling all these different layers to that, and really grounding it in the practical sort of challenges that they're already actively working on, I think is the best way. Because if it's sort of a theoretical case study that you're working through, it doesn't really ever click. But when it's when you realize that these methods do provide different lenses and perspectives to something that you've been already thinking about for months, maybe even years, that's where it really can change the way that you operate going forward.
And maybe if I could just add one thing, Tracy, to what you were saying around how women, it's not a delay. When I first got into human-centered design, we kind of defined this aspirational framework where, like, when a family is, let's say, just thinking, they care about the education and health of their children. That is not the question. But when they're worried about, if you think about it as like a ladder, right? And if you're worried, you're here and you're worried about just getting food on the table, you need to prioritize, right? And so it's this idea of, how do you help enable that shift in prioritization through programming?
Yeah, no, completely agree. And also so many of these things are negotiated, and how are they negotiated across social units like families and so on. I just wanted to call out that we did a similar sort of set of trainings in sort of tools, but also mind shift changes with our Nigeria country office in Abuja. And one of the designers, Nico, is on the call, so we should actually connect your colleague, and I'm forgetting his name, but I saw him come up on the call. We should probably connect those two because it seems like good synergy there.
Awesome. Well, Jumana, I thought it was really interesting how you talked about strategic foresight. We haven't really talked about that methodology. Can you tell us more about that being as one of the important sort of shifts in your four shift framework? Oh, unfortunately, you're still on your mute. Yeah.
Sorry. Strategic foresight is a way to really think about the future as options. I'm going to try to just be very basic, I don't want to be too basic about it, but I'm sure a lot of you know what this is. But really, it's really taking a view from moving from, so let me just talk about the shift a little. So a lot of times of what we do in global public health, we go to forecasting. So we use past data or past information to help us figure out what we're going to do in the future. And we usually have one pathway of getting there, or can have one pathway of getting there. And what strategic foresight enables you to do is really look at the future as a set of options. And that way it helps you think about, okay, if we go a certain way, what are the possibilities of things that we can do? And if there are things that we need to mitigate or account for, global mega trends, climate change, displaced populations, et cetera, how do we take those into account in what we are designing and implementing today? So that's the idea of strategic foresight. I think it's really, really powerful because it shifts your thinking from, okay, I have a plan today, and this is what I'm going to implement. Rather, it moves you to thinking about, okay, there's a set of possibilities, and this is what I can learn as I move forward. So what you do today can then inform or kind of create what you do tomorrow. And that's how we think about strategic foresight. I think the powerful combination of systems analysis, systems thinking, strategic foresight, human-centered design is that you're then designing a preferred future that really takes the ecosystem elements into account.
Yeah, that's a wonderful summary. And I love the way that you all are working at the bank, which is really sort of reimagining primary healthcare, and it goes back to the point that I had at the beginning, where it's no longer about taking Western models of what works, but really redesigning, reimagining healthcare in a way that works for that particular country, for that particular context. And so that's such an important part of strategic foresight, the creativity that gets that's already sort of inherent in that methodology, to allow it to be something that's entirely novel, rather than drawing on past trends or past mechanisms that have worked. But there are very specific reasons and conditions in which those work. And I don't think we often recognize that. But when you tease that apart through this like very quantitative and qualitative analysis required for strategic foresight, that's when you start to realize, oh, wow, the conditions for the past are no longer the same. And now we need to rethink the future. So,
and I think that, there's a set of mindsets that come around that. How do you be more adaptive? You have to be comfortable with uncertainty. Your planning has to, be flexible to what you don't know today. And I think those are the real mindset shifts in planning and strategy that it enables.
Good. This is great. So before I open up to questions, I just wanted to get to sort of one more topic. And I think we've already touched upon it a little bit here, but really when we're just thinking about the future vision of how we want to tackle global health, in your mind, what types of methods and methodologies, or what types of studies, and should we be absolutely sort of funding and supporting to truly make sure that the delivery systems and that we develop are equitable and people-centered. What's the vision for how global health should be thinking about today's challenges and future challenges? Tracy, maybe I'll turn it over to you to go first.
Okay, sure. Well, I mean, one thing I can put a little plug in here. So as part of the Design for Health community, we brought together members of that community, and we have a special issue of Global Health Science and Practice coming out. I think it will be launched in exactly a month, maybe a month and a day, October 31st. And some of what we've done there is actually talked about the need to, well, one, on the design side, and I should say, I call it design because I think all design is human-centered, and in my approach to design, often take that sort of systems thinking lens as well. And so that term sort of encompasses a lot, and I think that's what you'll see in the special issue. But one of the things that we are strongly advocating for is that we need to be more creative. We need to, first of all, we need to measure design more effectively. But to do that, we need to get more creative about what are we looking at and what are we measuring over time. So often we look for in global health, we look for these very specific outcomes, numbers of lives saved, increase in antenatal care visits and so on. But if we are going to take this holistic contextual systems lens to it, we have to think more creatively about what is our theory of change, and what are we measuring to see how that change is occurring as we go forward. So some of what you'll see in the special issue is a suggested theory of change for design and global health projects, suggested measurements, and so on. And so I think that is something that is really exciting. And I guess I would go back to I would go back to something we talked about in the beginning of today's session a little bit. I do think that we think of health as residing in the individual. And in many ways it does. Like, an individual has things about them that are healthy and has other things that unfortunately are not healthy. But really, health is social. It resides in a social space where people are making decisions about their health, not sort of from that individual lens. And so how do we start really thinking about how we go from the individual to the social, to the full system? And that's something that I think, I still think is something that we need to break through a little bit in the field of global health to help that thinking go forward.
This is great. So now is really the time for the audience to ask questions. So we already see a few in here. So I think Jessica had a really good question about sort of one of the practicalities that we face, which is sometimes, sort of the cost or time constraints of being able to do human-centered design. Do either one of you sort of have any commentary on whether it's really true that, implementing some of these methods can be costly, and if so, then how do we sort of address it?
I don't mind jumping in first because it's something I profoundly disagree with. So, right, I imagine you would disagree as well, Jumana. We do in global health, we actually do a lot of things over and over again. And so, maybe an initial way of thinking about it is that it may cost more money and it may take more time, but if we actually get the problems right that we're trying to solve and we frame them from that people point of view, I think that we're going to find that we've solved them much faster, and that the net gain in terms of time and expense is actually going to be faster and less expensive.
Right. And there's also this notion in human-centered design about prototyping to learn, right? So you want to be able to really create the most minimal sort of experiment or product or service out there to really obtain those learnings, so that you're not investing huge sums of money and then realizing that you had a failure point. You want to be able to sort of work through those in really low cost ways. And there are very novel sort of techniques or ways to do that, whether that's like a paper prototype to something that's more complex in terms of standing up, a small element of a service delivery intervention or what have you. So
it de-risks the process as opposed to brings in risk, which is
right. Very good. There's another question here from Helen, who's talking about sort of the practice of human-centered design and how that's evolving. So we talked about human-centered design, augmenting that with these other methods and sort of methodologies. But what about human-centered design itself? Is that evolving over time? Jumana or Tracy?
I mean, I'd like to kind of put it out there in the way that I think it may want to evolve. I'm, again, not a technical human-centered design person, so there's probably some literature I do not know about, but I do think, I mean, if you do take just what's happening in Madagascar today, there is the first ever climate-induced famine happening in the south of Madagascar, which is horrifying. And so I think we have to think about HCD or design and more comprehensively, and really think about the age of the Anthropocene in which we're living, meaning that our actions as humans are really having an impact on the earth. And so this underlines my belief that human-centered or design is central to systems thinking, because we need to think about solutions that are sustainable in the world that we're living in today.
Thank you so much for that, Jumana. I think my own perspective, again, there's probably literature out there that I'm not aware of, but it's the power of ethics as well. Incorporating some of those sort of best practices or frameworks to kind of look beyond just the initial sort of intended consequences, but to think through sort of the unintended consequences of those that you're actually not serving, looking at the non-user, for example, looking at other groups, stakeholder groups that may, that should be considered in your equation as you're trying to design your intervention. So I think there's a lot to be learned there to bring best practices from that field as well. Yeah, Tracy.
No, I was just agreeing with you. Sorry.
Great. Let's see, we're getting all these great questions here. Let's see here. What are ways that junior researchers could be looking to advance the skills to be able to connect the fields together that we've been talking about here?
I can jump in there because that's actually something I do some work on. So completely agree with that there aren't design curriculum right now situated within global health programming, with the exception of the fact that a colleague, Patrick Whitney, who actually led the design school at the Illinois Institute of Technology for many, many years. And so whether you realize it or not, has had a huge impact on how we think about design in the world today. He is actually starting a design for health curriculum at Harvard's Global Public Health School. At the same time, there are other schools where you can actually, what people are doing is looking to their business schools that are combined with their public health programming to take design classes there, and more. Oh, Andre's on the call. Yep, Andre's part of that too. Great.
Basically, we just invited all our friends to this call.
So in Berkeley, there are classes that are run out of the business school, but particularly to think about design in areas like global health and other areas of social impact. So they are there. You have to look around, and hopefully Patrick and Andre, as they move forward with their programming, will influence many other institutions to take up such programming.
Great. Tracy, there's just one little quick question for you, which is you mentioned the publication that's coming out a month from now. A lot of the people on this call would be curious about how they can access it. So could you remind us again on sort of the journal where it's going to be published and how to access it?
Sure. It's Global Health, Science, and Practice. And that is run out of Johns Hopkins University. And so it will be available online. You can also go to, or you'll see the announcement for it on designforhealth.org.
Great. Yeah, so this is great. Everyone's been asking questions both in the Q&A and in the chat, so that's really great. I'm scanning that as we go. I think we have a really great question here from Timothy, who's asking about how often, global health has, a lot of rigor in terms of the way that we sort of set up and then measure impact, especially the elements of global health that has a clinical component to it. And that's really actually demanded in terms of the way we roll out these interventions. So how do you sort of like address the this idea about creating credibility for human-centered design for practitioners who have more of that sort of quant mindset, the mindset around, RCTs, randomized clinical trials, et cetera?
I'm happy to take a shot at answering that. So it's actually something that you had said earlier, Tracy, on the types of research. I think there's two things that kind of need to happen. One is that I do think there's this idea that heavy quant research and data and numbers are kind of what defines progress. It's this shift towards making other anthropological data, early uptake of interventions in use, these different other data points just as valuable. And I'll give you an interesting story that I had from one of the programs that I was working on, and it was you could see the shift in our very focused RCT design person who was an economist, PhD economist at the World Bank. And she basically, her and I did this program where we were looking at HCD and bringing in HCD as a way to test and prototype service delivery and interventions. And going through that process, she said, I wish I had known about this before. It's a way to really, and we've talked about this, to de-risk. So imagine you go through a long RCT of 3 years, literally millions of dollars, which we've all done, I'm sure, at some point, or as many of us have done. And then you just find out that it didn't work, right? So imagine right before that, you test a set of solutions or intervention ideas, and you get to a higher fidelity. And it kind of just blew her mind on that, right? And so I think there's a place for HCD in so many different ways, both in terms of the data that we prioritize and the types of information we prioritize when we're designing programs and measuring impact, but then also as we think about more rigorous programming, how human-centered design can really help get to a higher fidelity of testing a set of solutions or interventions through a more expensive and more rigorous quant implementation. Thanks.
Just to add on to that, I agree with everything, Jumana. And when we think about where does design need to go, it needs to go to being more open to this sort of mixed methodology work. And the pathways investment on vulnerability that I was talking about is exactly that. It's behavioral economics, it's anthropology, it's design, and it's large-scale quantitative surveying. So design also needs to open up to that sort of broader set of methodologies. What I like to say is, quant data drills into a very specific point, and so it goes deep into one area. And what we need is that qualitative work, and this borrows from anthropology and the notion of thick description. We need to bring a thickness to the data. to really sort of understand, again, like what is that lived reality of the people who are behind those data points. Because if we're going to solve their complex challenges, we need to respect the thickness and the fabric, I think, that you had mentioned earlier, Jumana, of their lives.
This is really great. So I can't believe the time flew so fast. We just have a couple minutes left. So I think I'll just sort of end with a closing question. You know, so many of the people on this call are innovation and design leaders themselves. They're trying to sort of help their organizations transform on this sort of journey to design maturity. What sort of like one piece of advice do you have to these leaders as you yourselves have been, you know, sort of champion design methods and mindsets at your organization? What's one piece of advice for an innovation leader who's really working to help strengthen organizations' ability to do this important work? Tracy or Jumana? Jumana, thank you.
Oh, okay. I get it's a great question. I think, you know, I work in a really big organization, so I'll draw on that experience. And I think there's a few things. One is, you know, start where you can. You don't have to HCD design everything or change your organization over time. We had an opportunity. We had, you know, great leadership and support we've had in really moving forward a few things. But when I started in the beginning, it was really hard. And so finding your allies and kind of your community as you're building, I think is really, really important. And one point that I would say is that, you know, we're about equity. And I think it's important in design to design for the extreme user, the extreme household. I think, you know, if we do that as a secondary, then oftentimes it doesn't get brought into the design. But if you design for the extreme use case, okay, and then pull it, it's easier to pull it backward for the majority or the masses. So really putting equity front and center of design, I think is really, really important. But I'm happy to talk more about it offline.
Tracy, any last thoughts?
Yeah, I think, you know, it can be hard, right? Being an evangelist and trying to bring in something new. And I think it's easy to forget that when you're doing that, that you really need to listen. And so Jumana's point, like, it's hard, understand the ways in, pick your allies, don't feel like you need to do everything. What I will say is that, you know, this is something people came to me at the foundation and said, you know, designers come into the room and they tell us to trust the process, and they tell us to be flexible, but it feels like they're not hearing us and they're not being flexible and they're not trusting our processes. And so what I tell new designers that I'm working with as they come into the foundation, like, you can't ask them to take it whole cloth the way you're giving it. You have to, just like we're telling them to do with design, you have to reach them where they are. And that is going to take also just really listening. So this is your opportunity to just to sit in the complexity and the ambiguity yourself and really listen and try to hear where they're saying, so you can go to them.
Thank you so much, Tracy. Thank you so much, Jumana. This has been such a wonderful discussion. Thank you everyone for the audience. I hope you have a great day. This webinar will be available on our website, and we'll sort of let the distribution list here know when they can access the recording. So thank you so much. Take care now.
Thank you.
Thanks, everybody.
Thank you.
Bye.
Bye.